really getting to understand how the resting membrane potential comes about. Now, the resting membrane potential is basically the events inside a neuron, specifically, at rest. So a neuron that is not excited, it is not firing an action potential. How do we get that state? How do we get to that resting membrane potential? We already talked about the value. That value was negative 70 millivolts, but how did we get to that negative 70 millivolts? That's what we're going to sort of try to describe today. Now, in order to describe the establishment of the resting membrane potential, we'll start by looking at two ions, sodium and potassium specifically, but understand that there are other ions that are at play here. There's chloride, there's calcium, but the two that we are most concerned about are potassium and sodium. Now, the RMP, or the resting membrane potential, exists because there's more negative charge inside the cell than there is outside the cell. We kind of talked about that before. That negative 70 means that with respect to the outside of the cell, the inside of the cell is negative 70 in terms of a more negative environment. All cells have a resting membrane potential, anywhere from -5 in certain cells to -100 in other types. But for neurons and most excitable cells, muscles also fall under this category, the resting membrane potential is about -70 millivolts. Okay, and we're going to spend some time describing how we get to that -70. So in order to do so, we're going to take a look at potassium individually, sodium individually, and then we're going to combine them together to describe how both of them have an effect on what the resting membrane potential ends up being. There are two important factors that we're going to consider here. First is the ion concentration gradient. We talked about the fact that if there's more of an ion in one place, right, inside or outside of the cell, that creates this concentration gradient. Another way of saying that is the chemical driving force. So that's a force that wants that ion to move according to that gradient. The second factor is the membrane permeability. So we can have as much of a gradient as we want. If the membrane is not permeable to the ion in question, we're not going to have any movement. If it's really permeable, we're going to have more movement. If it is a slightly permeable, we're going to have less movement. Okay? So the concentration gradient and the permeability are two important factors in establishing this resting membrane potential. Now, this is a really nice table to kind of distinguish between some of the potentials we're going to speak about. You're going to hear me say the word potential quite a bit. So this is a nice way to decipher exactly what we're speaking about. Now, a potential in its most basic sense is a ability to do work or to move a particle in one way or the other. And so we can speak about the membrane potential. We already talked about that. That had to do with the difference of voltage across the plasma membrane. Basically, the fact that there's more negative ions inside and more positive ions outside. We can also speak about the resting membrane potential. That's what we're describing today. What the membrane potential looks like when the cell is at rest, when it's not receiving or sending any signals. We'll eventually speak about graded potentials and action potentials, which are more substantial changes to the membrane potential that create this large influence, this large ability to do work, right? More specifically, the action potential. And then the equilibrium potential we already introduced. This is the membrane potential at which an ion is not moving. When the CDF and the EDF are exactly equal and opposite, that ion is said to be at equilibrium. And at that potential, that ion in question is not moving. Okay, so not to memorize any of those terms, but just really to understand the differences, I use those terms going forward. Now, one of the most important and influential factors of establishing the resting membrane potential is the sodium-potassium pump. We spoke about this pump before. It is a mechanism of primary active transport, and it involves pumping sodium out of the cell and potassium into the cell. Now, 20% of the resting membrane potential is directly attributed to the sodium-potassium pump, and that is because of its job, right? Because it's moving potassium in and moving sodium out it's creating a net flux of positive charge leaving the cell, right? More sodium is going out and potassium is coming in. So we have this overall net movement of positive charge going out the cell, which leaves behind this negative environment inside the cell. 80% of the resting membrane potential is indirectly attributed to the sodium-potassium pump. And that is, again, because the sodium-potassium pump maintains the relative ion concentrations. So it's going to maintain sodium at a higher concentration outside and a lower concentration inside. And potassium is going to be the opposite. It's going to be at a higher concentration inside the cell and a lower concentration outside the cell. So the sodium-potassium pump is involved directly and indirectly in establishing the resting membrane potential. Okay. All right. Now, when you look at a typical neuron, it is actually much more permeable to potassium than it is to sodium. And just to describe what that permeability is really referring to, we're talking about the number of channels on the neuron. So we say that an ion is more permeable if there are more channels, there are more opportunities for that ion to move through the membrane. And in the case of potassium, there are 25 times more potassium channels on a neuron than there are sodium channels. So we can say that potassium is 25, or the membrane rather, is 25 times more permeable to potassium than it is to sodium. So there's more of an opportunity for potassium to move than there is for sodium to move. We're going to speak about why that is really important in establishing this resting membrane potential. We also want to identify the ion distribution, which we mentioned a little earlier. There's more sodium and chloride outside the cell, sodium being positively charged, chloride being negatively charged, and they kind of oppose each other. And there's more potassium and other organic anions, such as amino acids, inside the cell, and they again sort of oppose each other, right? That negative and positive balance out and oppose each other. So these are important facts for us to establish before we can go on to kind of talk about how this comes about.